Hello, Miss. Good day. I'm Romel, and I'm the clinical pharmacist of Riverside Medical Center. And for today, we're gonna do patient clinical history documentation. So the importance of this process is uh, is that this documentation will be used for the appropriate treatment plan for our patient. Okay. So first, I would like to ask your name and your age.
So, good day also, sir. I'm Joylyn Parcon and 23 years old.
Okay, so I would like to ask for your social life, your social history. Okay, so do you have work?
Yes, sir. Currently, I'm working as a call center agent.
Okay, how about drinking? Do you drink?
Yes, sir. I'm more on a hard drinker side.
Okay, so do you smoke?
Not at all.
Okay, so Miss, I would like to remind you that some question in this process contains a bit personal questions, but I would like to remind you that it's important for this process. Okay. Okay, so we'll go on. So I'll ask for some of your medical history. Like, do you have previous medical operations?
No, sir.
Okay, so how about your past medication or your current medication being taken currently?
Yes, I have. So, in my past medication, I take paracetamol for my headache. It is only for occasional use, and I also take two types of antacid, which is omeprazole and ranitidine, and I also take laxative, which is disacodil.
Okay, how about vitamins? Do you take any vitamins?
Yes, I also take ascorbic acid and parasulfate.
Okay, how about some, herbal supplements? Do you take any herbal supplements?
No, sir.
Okay, so your concern is that you're concerned with your upset stomach. Okay, so I'll ask some question about the symptoms that you may be experiencing right now. Okay, okay. So do you feel nauseous or acid-like symptoms?
Yes, sir. Most of the time.
Okay, so did you lose appetite?
There's just time that I don't feel like eating, especially in the breakfast because of my upset stomach.
Okay, so does it affect your weight?
Yes. The last time I checked, I've already lost 3 kilos of my weight from 47 to 44 kilogram.
Okay, so how about your stool? Is there any changes or any unusual in your stool? Like, is there blood in your stool?
Yes, there is just a little bit of bloody fluid.
Okay, so how about the color of your stool?
It's a black stool.
Okay, is your stool normal, like normal stool, or it's a watery stool?
No, it's not, sir.
Okay, so how about your bowel movement or the frequency of your bowel movement? Is there any changes?
No, sir. No.
Okay, so it's a bit personal question. Okay, so but it's important in this process. Okay, so is there it's all about your family history. Okay, so is there any in your family that have cancer before?
No, sir.
Okay, so is there in your family that experienced peptic ulcer before?
Yes. In my mother's side.
Okay, my bad. So, aside from peptic ulcer, is there in your family that experienced stomach complications before?
No, sir.
Okay, so now let's move on to your vital signs. So, I would like to ask about your respiratory rate. Is there any changes in your respiratory rate?
I think it's normal, sir, for it is 16 BPM.
Okay, how about your pulse rate?
It is also normal.
Okay, how about your temperature?
I forgot. I'm not sure.
Okay, so let me check your record here, okay? For a while. Okay, so in your temperature, it shows that you have elevated temperature, primary or may elevate to fever, okay? So that's it for this documentation, and I would like to express my apology for not meeting you physically, but still we did it virtually. Okay, so thank you so much for the time you spend with this conversation. Okay, and lastly, if there's any concern, you can always reach us in our office.
Thank you also, sir. God bless.
Yeah, as always, thank you.